So the Oncotype DX test is a test that we can use to look at the genomics of an individual patient's cancer. By sending it off and having the molecular analysis, we can look to see if there's a genetic or genomic pattern within their tumor that's going to make the tumor a high risk of recurrence or low risk of recurrence. The test then generates a recurrence score, and based on that recurrence score, we can determine if we're going to treat somebody with chemotherapy or not. If I'm a physician, I'm going to use that Oncotype DX recurrence score to help stratify which patients are going to benefit from that. And there's two ways I do that. The first way is in patients who have stage 2 colon cancer, where they have a T3 or T4 lesion, and that just basically means how deep through the wall has it been penetrated. Has it grown to the edge of the colon wall or through the colon wall? And if it has, these patients may benefit from chemotherapy, but it's still a gray area. I send their tumor to Oncotype, have them do the genomic study on their cancer, and if it comes back with a high recurrence score, then I'm going to offer this patient chemotherapy because they're at higher risk of recurring. And if they have a low recurrence score, then I won't offer them chemotherapy because there's no absolute benefit. Similarly, if I'm a patient and I have a tumor that's got a T3 or T4 depth, and I have a high recurrence score, well, I'm going to want that chemotherapy because I'm going to want to prevent that tumor from coming back. I'm going to do whatever it's going to take. And if I have a low recurrence score, well, I'm not going to want that chemotherapy because it's not going to benefit me, and why should I undergo those side effects?
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.